Hello, welcome to today's session. Attempt the following questions first, and let's review them together. Question 1. Question 2. Question 3. Question 4. Question 5. Question 6. Question 7. Question 8. Question 9. Question 10. Question 11. Question 12. Question 13. Question 14. Question 15. Time is up. Let's now review the questions together. Question 1. Option B is correct. This is because during the acute phase of ischemic stroke, blood pressure is often allowed to remain elevated to support cerebral perfusion to ischemic brain tissue. Aggressive blood pressure reduction at this time can decrease cerebral blood flow and worsen neurologic injury. Blood pressure is treated only if it exceeds recommended limits or if thrombolytic therapy is planned. Why are the other options incorrect? IV antihypertensives may be used later, but are not initiated routinely during the acute phase. Thus, option A is incorrect. Oral antihypertensives are not appropriate in acute neurologic emergencies, making option C also incorrect. Option D is also incorrect, as lowering BP to normal limits can compromise cerebral perfusion in this case. Question 2. The correct answer is option C. This situation suggests hypertensive emergency, severe BP elevation with signs of acute end organ damage, especially neurologic, confusion, severe headache, visual symptoms. In a hypertensive emergency, the priority is rapid evaluation, continuous monitoring, cardiac/neuro, IV access, and controlled BP reduction with IV medications per protocol. The nurse must escalate immediately because delay increases the risk of stroke, intracranial hemorrhage, myocardial ischemia, and kidney injury. Option A is incorrect because comfort measures do not address likely end organ damage, and delaying could be catastrophic. Option B is incorrect because, while rechecking is reasonable in mild elevations, the clinical picture already shows danger signs in this situation. Therefore, the priority is escalation and stabilization. Option D is also incorrect. Oral meds act too slowly and are not appropriate for an emergency requiring controlled IV titration and monitoring. Question 3. The correct answer is option A. BP is highly influenced by recent activity, caffeine, anxiety, talking, and positioning. Standard technique improves accuracy. Seated, back supported, feet flat, arms supported at heart level, correct cuff size, and rest. This prevents mislabeling a transient elevation as uncontrolled hypertension and helps avoid inappropriate medication changes. Option B is incorrect because retaking the BP immediately will still reflect the effects of acute stress/coffee/activity. Option C is also incorrect because orthostatic BP is assessed for dizziness/falls, not for confirming baseline hypertension. Why not option D? Clothing can interfere with cuff compression and falsely elevate readings. Question 4. Option B is the correct answer. Thiazide diuretics increase urinary excretion of sodium and water and can also lead to potassium loss, causing hypokalemia. Symptoms include weakness, cramps, and cardiac irritability, palpitations, irregular pulse. Hypokalemia can precipitate dangerous dysrhythmias, so this is the priority concern. Hyperkalemia is more common with ACE inhibitors/ARBs or potassium-sparing diuretics. Symptoms differ, often weakness, peak T waves. This makes option A incorrect. Option C is incorrect because thiazides typically reduce volume. Hypernatremia/overload is not the expected mechanism here. Option D is also incorrect. The BP improved. Symptoms point to electrolyte effect, not treatment failure. Question 5. Again, option B is the correct answer here. ACE inhibitors can cause angioedema, swelling of lips/tongue/face, which can quickly obstruct the airway. This is a medical emergency. Recognizing emergent symptoms is essential safety teaching. ACE inhibitors may also cause dry cough and hyperkalemia, but angioedema is the most urgent risk. Option A is incorrect. Many salt substitutes contain potassium, leading to the risk of hyperkalemia with ACE inhibitors. Option C is also incorrect because antihypertensives are taken consistently to maintain control, not PRN. Cough should be reported, as it may lead to a medication change. Thus, option D is also incorrect. Question 6. The correct answer is C. Angiotensin receptor blockers, ARBs, are commonly used when ACE inhibitors cause cough because they are less likely to cause cough. However, angioedema can still occur, less common, so patients must recognize emergency symptoms. This answer teaches realistic expectations. Hypertension is managed, not cured, and medication works alongside lifestyle changes. Absolute no-risk statements are unsafe. Thus, option A is incorrect. Hypertension is typically chronic. Stopping therapy due to feeling better is a common adherence trap. Thus, option B is also incorrect. Zero sodium is unrealistic and not standard teaching. Thus, option D is incorrect. Question 7. The correct answer is option B. Dihydropyridine calcium channel blockers, like amlodipine, commonly cause peripheral edema due to arteriolar dilation, leading to fluid shifting into tissues, not due to true fluid overload. Since there are no heart failure signs, clear lungs, stable weight, teaching and monitoring are appropriate. The provider may adjust therapy, add another agent, or change medication if edema is bothersome. Option A is incorrect because stopping abruptly without provider guidance risks rebound hypertension and lacks a clinical indication here. Option C is also incorrect because fluid restriction does not address the mechanism and may cause dehydration. Potassium has no role in calcium channel blocker-related edema, making option D incorrect. Question 8. Option A is the correct answer. Beta blockers can blunt adrenergic responses to hypoglycemia, particularly tachycardia and tremor, which are early warning signs. Diabetic clients should rely more on blood glucose monitoring and other symptoms, sweating, confusion, and treat lows promptly. This is a safety-critical teaching point that prevents severe hypoglycemia. Option B is incorrect because dry cough is more associated with ACE inhibitors. Potassium restriction is not standard for beta blockers. Thus, option C is incorrect. Option D is incorrect because scheduled dosing maintains steady control. Question 9. The correct answer is option B. Before escalating therapy, the nurse should assess for pseudo-resistant hypertension, missed doses, incorrect cuff size/positioning, measuring right after activity, and over-the-counter medications like NSAIDs and decongestants that can increase BP and reduce antihypertensive effectiveness. This is high-yield nursing judgment. Fix modifiable causes first. Why is option A incorrect? Unsafe. Dose changes require prescriber oversight and can cause hypotension or electrolyte issues. Why is option C also incorrect? Monitoring supports management when done correctly. Option D is unrealistic and not evidence-based teaching, so it is incorrect. Question 10. Option A is the correct answer. ACE inhibitors/ARBs provide benefits beyond BP reduction and diabetic kidney disease. They reduce intraglomerular pressure, decrease proteinuria, and slow progression of kidney damage, unless contraindicated. This is a concept question grounded in pathophysiology and long-term outcomes. BP lowering helps stroke risk, but rapidly and prevent all are inaccurate, making option B incorrect. ACE inhibitors/ARBs can increase potassium and require monitoring, making option C incorrect. Lifestyle change remains essential at all times, so option D is also incorrect. Question 11. Option C is the correct answer. A consistent pattern of normal home readings with elevated clinic readings suggests white coat hypertension or situational elevation. Best practice is to confirm the measurement technique and use out-of-office data to guide decisions. This prevents overtreatment that could cause hypotension, falls, or kidney hypoperfusion. There are no symptoms or emergency level BP, so option A is incorrect. Option B poses overtreatment risk. Assessment and confirmation should be done first. Option D is incorrect because home data is valuable when obtained correctly. Question 12. The correct answer is option A. DASH-style eating patterns, fruits/vegetables/low-fat dairy/whole grains, and sodium reduction have strong evidence for lowering BP and improving cardiovascular risk. The key angle is realistic, sustainable change rather than extreme, non-standard restrictions. Option B is not a standard treatment approach for hypertension and is overly restrictive. Supplements are not reliable or standardized and may interact with meds. Thus, option C is incorrect. Caffeine may cause transient increases, but total elimination is not routinely required, making option D incorrect. Question 13. The correct answer is B. ACE inhibitors are avoided in pregnancy due to fetal risks. The nursing priority is prompt escalation for medication change and ensuring BP remains controlled with a safer alternative. The key is not panic stop, but safe transition under provider guidance. Why option A is incorrect? Abruptly stopping without a plan can lead to uncontrolled hypertension and maternal/fetal risk. Option C is incorrect and unsafe. Option D is non-evidence-based and unsafe. Question 14. Option C is the correct answer. Swelling of the lips/tongue with breathing difficulty suggests angioedema, which can rapidly obstruct the airway. This is a do not miss discharge teaching point. Airway threats and patient safety education are always prioritized. Option A is a common early side effect and should be monitored and reported if persistent or severe. Option B is an expected diuretic effect. Option D is often a result of orthostatic hypotension. The nurse should teach slow position changes and hydration within the plan. Question 15. Option C is the correct answer. Unlicensed assistive personnel can collect objective data such as vital signs when properly trained. Teaching, assessment, and evaluation require nursing judgment and must remain with the RN. Correct delegation improves workflow while protecting safety and scope of practice boundaries. Classic nursing management content. Option A is teaching, which requires the RN. Option B is a post-med assessment, which involves clinical judgment. Option D is evaluation, which is a responsibility of the RN. Thank you for studying with us today. If you have enjoyed this session and look forward to doing this again, kindly hit the subscribe button and be among the first to be notified whenever a new review video is published. See you in the next video.